Hi, my name's Melisa, and I'm a psychological wellbeing practitioner and assistant psychologist at the private therapy clinic. In this video, I'll be discussing vaginismus, which is an incredibly distressing condition affecting approximately 5 to 17% of women. Vaginismus is a condition where the vaginal muscles tighten or contract in the anticipation of penetration, despite a woman's wish to actually do so. This doesn't necessarily have to be in a sexual context and can actually be issues attending gynecological exams or even inserting tampons. The pain has often been described as a burning or stinging sensation or a sharp pain. There are two types of vaginismus. The first is primary vaginismus, which is essentially when a woman has never been able to experience non-painful penetration. In other words, it's just been a lifelong condition where they've had issues inserting tampons or trying to achieve penetrative sex. Secondary vaginismus is when someone once was able to experience non-painful penetration, but after a certain event, perhaps after childbirth, or after menopause, or even after a traumatic sexual experience, they're no longer able to enjoy sex or achieve penetrative sex or insert tampons and things like that. Vaginismus was actually defined as a spasm-based disorder according to the Diagnostic and Statistical Manual Edition 4, or the DSM-4 for short. The DSM-5 has actually changed this due to a wealth of research actually showing that it's not the spasm that's actually really causing the vaginismus, but it's really our attitudes or a really strong fear surrounding sex or penetration. It has also been combined with dyspareunia, which is another type of sexual dysfunction which involves genital pain before, during, or after sex. So as I mentioned before, the prevalence in clinical settings of vaginismus is roughly 5 to 17%. But honestly, this might even be a much higher number, and a lot of people actually feel shameful or embarrassed to even bring this up with their clinicians, such as a GP or a nurse or even a therapist, due to the taboo nature of sex itself. Some of the biggest factors causing vaginismus include a history of sexual trauma or very negative sexual experiences, a restrictive upbringing surrounding sex, and inadequate sexual information. Although vaginismus has a lot of roots in psychology, it's really important to rule out any physical conditions that could be resulting in this type of sexual dysfunction. This could be things such as a urinary tract infection, hormonal imbalances, or perhaps even structural issues that have always been there, particularly in the case of primary vaginismus. Once we've determined that physically everything is okay, then we can start to really tackle this using psychological therapy. The most appropriate therapy that has a lot of evidence behind it in treating vaginismus is cognitive behavioural therapy. Before I go on, I'll just give you a brief overview of what cognitive behavioural therapy, or for short CBT, is. CBT is essentially a type of therapy that really tries to understand the relationship between our thoughts, emotions, physical sensations, and behaviours, and how all of these work together to interpret a given situation. By understanding these areas as separate entities, we can basically start to intervene before they start feeding into each other in a problematic way. I'll give you an example of how this can actually be used for vaginismus. So let's take Amy as an example. Amy has primary vaginismus. She's never been able to insert a tampon when she hit puberty. Her first time having sex was very painful. And since then, she's never been able to actually have a positive sexual experience in terms of penetrative sex. Right before penetration, Amy would think, my vagina is too small and sex will be painful as a result. Because of this, she became very fearful of sex and became very anxious and very hypervigilant of the situation. This resulted in painful pelvic contractions, which then actually confirmed her belief that sex will be painful, and she could possibly still believe that it is due to her vagina being too small. But we actually know that our vaginas are able to grow by substantial amounts when sufficiently aroused in sexual settings. So this leads me on to my next point, which is sex education. This is actually a vital component of vaginismus treatment, as it basically ensures that you have a good understanding of the female anatomy and of sex generally, which will allow you to disconfirm any maladaptive beliefs that you might have. So this type of education can be providing yourself with accurate information surrounding the vagina or sex generally, clarifying any sexual myths, and even trying to explore masturbation as an option if that is culturally appropriate for you. Masturbation can actually be seen as our training ground for really understanding what we find pleasurable, what we don't like, and it will basically give us a baseline of what a pleasurable experience of sex really could look like. This is related to my next point of trying to cultivate body awareness. Body awareness will allow you to develop self-confidence in your body, which a lot of research has actually shown is very important in sexual well-being. Many people, and especially women, feel very uncomfortable with their genitalia, and engaging in some exercises can really help to overcome that kind of discomfort. This can actually be as simple as using a small mirror in a comfortable space, maybe the sofa or the bed, and just really noticing small things about your vagina. So this could be, for example, noticing what the texture and the color of your pubic hairs are like, maybe the texture of your labia, or in other words, the vaginal lips. You can also gently use your fingers to just feel around and kind of decipher what feels good, what doesn't feel good, maybe what parts are more sensitive than others, and that will also help you to understand what a pleasurable experience in the bedroom could look like. The next component of treatment isn't as much psychological, but is very important and has been proven to really help women with vaginismus. Pelvic floor exercises help you gain control over the muscles surrounding your vagina, and this will actually allow an increased blood flow to the vagina, resulting in more pleasure and more sensitivity in that area. This is especially helpful for women who lack sensation in that area generally, or who experience difficulties with inserting tampons or penetration. These exercises involve contracting the pelvic muscles for a number of times every single day. When trying out these exercises, it might actually be a little bit difficult for you to know if you're contracting the right muscle, especially if you've never really done it before. A good way to just test out and see if you're contracting the vaginal muscle is to just gently place your finger over the entrance of your vagina, and you should be able to feel it tensing. The final element of treating vaginismus is using graded exposure. This is another component of CBT which has a lot of research supporting it in the treatment of vaginismus. It involves gradually exposing yourself to penetration, starting by using a small finger and then working your way up to something more penis-like. It will allow you to habituate yourself to penetration and reduce your fear surrounding sex in baby steps. This is actually where we can target any avoidance behaviors that you might have. In other words, it will target whether you find yourself avoiding sexual activities, sex with your partner maybe, or sex at all, or trying to avoid using tampons because of the fear surrounding the pain. Research has also shown that dilators can be very effective in this process. If you're working with a therapist, they would actually assign these types of graded exposure exercises to you for you to do outside of the session. In your next session, you would then debrief how they went, and it's very important that all the exercises are very manageable and nothing is too much all at once. Thank you so much for watching, and I hope you enjoyed this video. There's absolutely no reason for people with vaginismus to continue living with this condition, as there are many great treatment options available. Hit the subscribe button if you'd like to see more psychology or mental health related videos, and make sure to like this video if you did as well. Thank you so much.